Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. With the CareCredit credit card, you can get the dental work you want or need now. CareCredit is accepted at hundreds of thousands of locations nationwide for preventative, restorative, and cosmetic dentistry. Today we're in Los Angeles, California with Dr. Daniel Naysan. Dr. Naysan is a member of the American Dental Association and specializes in aesthetic smile design. He practices cosmetic, general, and emergency dentistry in the heart of Beverly Hills. Today we're talking about dental crowns and fillings. Thank you so much for joining us today, Doctor.
Thank you. Thank you for having me.
So let's get right to it. What exactly is a dental crown?
So dental crown is a restoration that covers full coverage all around the tooth, something to reinforce the tooth completely when it's been really damaged.
So are there different types of crowns? It sounds like there might be. And what is each one made out of?
So as far as technique-wise, you can do what's called a full coverage crown, covers all around 360 degrees. And there's something else called a three-quarter crown. So it only removes the part of the tooth structure that is weakened and leaves integrity of the other part of the tooth so that you don't have to shave around the whole tooth.
And when would you need to get a crown?
So patients that need crowns are the ones that have deep cracks and fractures, for instance, or they have a lot of their tooth that's missing, big cavity. So it's more extreme cases.
Is this a painful procedure?
If it's done with local, nothing should be painful.
Okay. And how long does the crown typically last? Is it something that they're going to have to replace in a few years?
So if it's done properly, it should last almost a lifetime, but the literature supports about 20 to 25 years.
So can coffee and other foods stain crowns?
They cannot.
And do you need to do any special care, or do you just clean them normally like brushing your
Same
teeth?
with your own teeth, just
Okay.
good hygiene.
So what exactly is a filling?
So filling is any type of restoration that is used to restore a small part of a tooth. So usually in cases where you have a small cavity or there's a small chip, a porcelain, composite or porcelain filling is a great option for that.
And when would you suggest a filling over a crown?
So when a lot of the tooth structure is healthy, sound, the filling's the option.
So you would really only need to opt for the crown if there is more decay.
Yes.
And what are the different types of fillings, and what is each one made out of?
So you can do a filling that's made out of the composite resin. That usually lasts about 5 to 7 years. There are other materials out there such as porcelain that can last a lifetime. And those are sent out to a lab. So a ceramist is making a piece of porcelain that goes inside the tooth that's custom fit. And the material is a little bit stronger than the actual resin.
Now, is the choice of the material of the filling up to the patient, or when and how do you decide what to recommend to each patient?
So usually if it's really small, we would probably opt for the resin.
Okay.
But if it's in the cases where it's in the gray zone, you're going to give the patient the option and let them know, because the cost of the porcelain, it's more of an investment financially.
That was my next question. Just what are the difference between the costs in a crown versus a filling?
So for a traditional resin filling, you're talking about a few $100s versus for porcelain filling, you're talking up to $2,000.
Now, does dental insurance typically cover these?
For the resin fillings, they do.
Okay.
On the porcelain fillings, they downgrade them. So, there is some out of pocket for the patient on that.
And what about for crowns? Are those usually covered as well?
They're usually covered at a percentage, depends on the insurance.
So if someone didn't have insurance, or they maybe needed additional financing, what other options do you offer?
So CareCredit, for instance, is a great option. It allows the patient to pay it over an extended period of time versus having to pay that big lump sum at once.
Is there a specific patient or memory maybe in your career that stands out to you?
I am blessed because I meet people from all over the world and the most interesting people. But personally, I'm big in athletics and specifically in basketball. So I was able to meet some incredible professional athletes
Wow.
through my career, and it's been a blessing.
That must be so exciting for you.
It has.
Yeah. Thank you so much for sharing all your knowledge with us today.
Thank you.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.